So you want to know if there are any benefits for prostate cancer surgery. Well, this video is all about prostate cancer surgery and whether or not there are any benefits. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher, and this channel is all about routine medical conditions, self-care, and digital health so you can be informed and in control of your healthcare needs. By the way, if this is your first time on the channel and you like to get fact-based healthcare information, go ahead and subscribe. Also, HEALTHdrum is for educational and informational purposes only and not a substitute for professional medical advice. The links to the disclaimer and the material in this video are in the description below. So let's look at a list of the many claims about the benefits of prostate cancer surgery and start sorting fact from fiction. So here's a list of the many claims that you will read about and hear about as to the benefits of prostate cancer surgery. That surgery enables complete removal of the cancer, it's a minimally invasive treatment, it allows for accurate staging and prognosis, it has the potential to avoid and delay other treatments, it results in an improved quality of life, it has psychological benefits and is associated with improved survival rates. However, remember, the healthcare arena is full of claims and exaggerations. So let's start with the claim that open or robotic prostatectomy removes the cancer completely. So surgeons are well aware that both open and robotic prostatectomy are highly unreliable at removing prostate cancer completely. In fact, studies show that between 11 to 48% of patients have residual cancer or positive margins after their surgery. As well, there's a very high incidence of biochemical recurrence within 10 years of surgery. This means that despite the prostate having been cut out, the PSA is rising because of residual prostate cancer cells somewhere in the body. Again, the references to this material are in the description below. So let's look at the claim now about robotic prostate cancer surgery being minimally invasive. So these claims about robotics and smaller incisions, the potential for less blood loss, the potential for faster recovery are generally true for robotics. However, these claims need to be measured against the facts such as reliability for removing cancer, complications, and whether or not prostate cancer surgery is curative. We've already determined that prostate cancer surgery is totally unreliable at removing the cancer completely. Therefore, it doesn't matter whether it's robotic-assisted surgery and that you get out of hospital faster when the surgery is unreliable for removing the cancer completely. Let's look at the next claim that prostate cancer surgery provides accurate staging and prognosis and see whether this is factual or mostly fiction. So staging is the process of trying to establish whether the cancer is still contained or spread, and if spread, how far. Prognosis, on the other hand, is trying to forecast the course or future of the disease or cancer. In contrast to the claims about prostate cancer surgery allowing accurate staging and prognosis, staging and prognosis are totally unreliable. The common imaging techniques such as ultrasound, bone scans, and CAT scans are recognized as being insensitive and unreliable for detecting small volume cancer spread. Currently, however, staging is done using whole-body MRI to detect bony spread and the PSMA, prostate-specific membrane antigen scan, to detect soft tissue or lymph node spread. However, PSMA PET scans are not foolproof as some prostate cancers do not express PSMA, leading to false positives, while other cancers and non-cancers can express PSMA, leading to false positive scans. Another concern is the fact that bone marrow aspiration studies have shown prostate cancer cells in the bone marrow of some patients with high-grade disease when the cancer in the prostate was very small and believed to have been localized to the prostate. Amazingly, these metastatic cells can lie dormant in the bone marrow for many years before some activate and spread. It's little wonder that treatments often deliver a temporary semblance of cure till metastases and spread appear years later. Now let's look at the claim that prostate cancer surgery has the potential to avoid or delay other treatments. So prostate cancer surgery, whether open or robotic, is associated with a high incidence of residual cancer or rising PSA and recurrent cancer. So some 11 to 48% of patients who had prostate cancer surgery are left with a positive margin or residual cancer. These patients commonly have postoperative radiation. This is also surprising because studies have shown that radiation for prostate cancer fails to save significant numbers of lives. On the other hand, a rising PSA or biochemical recurrence is found in about 20 to 40% of patients within 10 years of surgery. These patients are commonly monitored until their PSA becomes significant, at which time they are often managed with intermittent testosterone suppression. As well, both open and robotic prostate cancer surgery are associated with a high incidence of complications, particularly with erectile dysfunction and urinary incontinence. Many of these complications require treatment and often retreatment because of treatment failures. Clearly, prostate cancer surgery does not avoid the potential for additional treatments. What about the claim that prostate cancer surgery enhances overall quality of life? The claim that prostate cancer surgery enhances overall quality of life is absolutely hollow and unfounded. Physicians are fully aware of the many dangers and lack of benefits associated with prostate cancer surgery. Surgeons commonly have patients undergo rigorous preoperative counseling to manage expectations about prostate cancer surgery. As well, the complications for both open and robotic prostatectomy include hemorrhaging, deep vein thrombosis, pulmonary emboli, damage to adjacent organs such as nerves, bowel, and rectum, a high incidence of residual cancer, a high incidence of erectile dysfunction and urinary leakage, and a high incidence of treatments and retreatments to correct these many complications. Now let's see whether open or robotic prostate cancer surgery provides any psychological benefits. So surgeons are quite aware about the many potential complications and residual cancer associated with both open and robotic prostatectomy. And to soften the disappointments and manage patient expectations, physicians recommend preoperative counseling techniques so that patients and their wives or partners are mentally prepared for dealing with one or more of the many complications. As well, they often recommend postoperative rehabilitation techniques for limp and leaking complications. Some studies report that 12 to 23% of patients experience regret about having had prostate cancer surgery. Clearly, the claims that prostate cancer surgery, whether open or robotic, provides psychological benefits is hollow. In my own practice, when I saw patients that had had prostate cancer surgery elsewhere, I found that many of them would downplay their complications because if I talked to the wife or partner alone, I would get a different viewpoint that was often far worse than what the patient gave. Now let's look at the claim that prostate cancer surgery provides improved survival rates. So let's take a good hard look at this screenshot. Does prostate cancer surgery save significant numbers of lives? In fact, urologists' own studies showed that at 12 years, surgery failed to save significant numbers of lives. Then another study taken out to 15 years showed that those that had had no treatment had similar survival rates to those that had had surgery or radiation. In other words, surgery or radiation was as good as having no treatment. And if you had no treatment, you didn't have any of the complications associated with surgery or radiation. Again, all the references to this material are in the description below. Clearly, the claim that prostate cancer surgery improves survival rates is bogus. So physicians are well aware of the big disconnect between claims and benefits. How do they justify their claims? So instead of answering the most elementary of medical questions, where is the irrefutable and reproducible evidence supporting prostate cancer surgery, physicians have chosen to stray from science into junk science. Despite the evidence against open or robotic prostate cancer surgery, physicians resort to smoke screens and claims that surgery is standard practice, routine care, gold standard, included in their medical guidelines for localized prostate cancer, and that the robotic device was FDA approved for prostate cancer surgery. However, despite these claims, the robotic device was FDA approved without any testing for safety or benefits. In fact, neither open or robotic prostate cancer surgery have ever been scientifically proven to be safe and effective. Instead, physicians continue to ignore the evidence and exaggerate the benefits while exploiting fear and doubt. What about the prostate cancer label? Are all prostate cancers equal? Are they all potentially deadly? So let's examine the prostate cancer label. It's important to realize that not all prostate cancers are equal or the same. In fact, most prostate cancers are outlived. Furthermore, the Gleason 6 is a pseudo cancer or bogus cancer and doesn't need treatment. As well, most other prostate cancers grow sluggishly, taking 40 years or more from the time of mutation to reach 1 centimeter in size. In fact, it's mostly the 10 to 15% of high-grade prostate cancers that are potentially deadly and responsible for the 30,000 or so U.S. deaths annually. Again, with respect to the prostate cancer label, there's a lot of exaggerating and misinformation. So why is it that the evidence about prostate cancer surgery says no, but physicians continue to say yes? So here's the answer to why the evidence says no, but doctors continue to say yes. Healthcare is financially driven. Healthcare information and recommendations are plagued with claims, exaggerations, and misinformation. As well, most published research is false, and only 11% of medical treatments are of known benefit. As well, despite most treatments being unproven, many are still labeled FDA approved, included in medical guidelines, and tagged standard of care or gold standard. And because healthcare is troubled by many financial conflicts of interest, it is very important for patients to do their homework. So let's recap. In this video, are there any benefits for prostate cancer surgery? You learned that prostate cancer surgery is associated with numerous complications, a high incidence of residual cancer, and fails to save significant numbers of lives. Therefore, there are few, if any, benefits for prostate cancer surgery, whether open or robotic. To learn more about routine medical conditions, self-care, and digital health, check out these other videos.